Hey everybody, it's Kat. This is going to be my birth plan video. I haven't written my birth plan out, so I'm kind of gonna wiggle through this somehow and hopefully be able to write a birth plan from me talking about what I want. I did print out this worksheet online. It's kind of got like boxes or suggestions, I guess, and so I'll go through that and discuss the ones that are important to me, I guess. I'm having a natural birth in a hospital with my doctor and a doula. So I guess that's the big thing to know about regarding this. Also, of course, the main birth plan is to have a healthy baby and, to keep me healthy too. So, whatever that takes if the situation arises. But as long as nothing comes up, this is what I would like to happen. And some of the procedures are kind of like a regardless thing. Anyways, so I'm just going to get right to it. We are going to be staying home as long as possible. The doula does come to the house and keep you here at the house for as long as possible so that you're not going to the hospital too early and stuck and put on their time restrictions and everything. Also, you're able to eat and drink at your own house. It's just more comfortable. It's a lot more of what I want for the whole process, but because of certain reasons, I have to be in a hospital. So that's that for early labor, really. Once we get to the hospital, the doula will kind of be able to listen to me and see where I am with my contractions and be like, oh, hey, we should go to the hospital about now. And we'll just follow her guidelines there. Okay, so according to this, attendance. I just want Matt and the doula present. That's, excluding nurses and doctors and everything. But even then, I want minimal interference, so I don't want nurses coming in every 3 seconds or anything like that. We'll see. But Matt and the doula are the only people to be in labor, to be in delivery, and immediate postpartum. For amenities, the next thing on the list, I'd like to bring music. I'm going to have my iPod. We might get some speakers, or the doulas, they might have some. And just have some really calm music, some meditative music maybe, some happy music, some stuff I have good associations with to kind of keep that positive feeling up. My big qualm with going to the hospital is that you go to hospitals for bad reasons when you're sick or injured. That's why you go to a hospital. So to go there for a happy reason, such as welcoming your baby into the world, it causes me a lot of anxiety, and that's why we got the doula, so that she can kind of help keep me calm, and keep my wishes there to have as much of a natural birth and to encourage a homey environment as much as possible. So I do want the lights dimmed. Again, the doulas keep like little tea lights in their bags to set up and everything. They'll have aromatherapy. I want to make everything as not hospital-y as possible. I do plan to wear my own clothes during labor. I don't know if I need to put that in there because you don't have to do anything, so I might just kind of leave that out of the actual birth plan. But I'll show you in my hospital bag video that I'll probably do tomorrow. Kind of what I'm planning. I want Matt to stay with me at all times. I don't want any medical students or anything, but it's not a teaching hospital, so that's not really a concern to me. I would like to eat, but the hospital doesn't let you, so we will have some snacks to kind of sneak in. They do let you drink clear fluids, however, so in order to keep that IV at bay, I'm going to have some coconut water and some Gatorade, anything that has electrolytes, and just keeps you hydrated, keeps you going. That way they can't really give you an IV with any excuses if you're doing that job yourself. I do want to have a HEP lock or saline lock, and intermittent fetal monitoring in order to be able to move around as I wish during labor. That's a big comfort to me. I mean, that's a comfort to me now, being pregnant. being able to get up and walk whenever I feel uncomfortable, or bounce on my birthing ball. That's the other one, which I'm going to bring my birthing ball with me. I don't know if they have one at the hospital because we never did a hospital tour. So I'm going to bring mine with me, put it in the car, and if they don't have one and will let me bring it up, then I'll send Matt back down to get it. I'm allowed to labor however I want, push however I want. I already spoke to my doctor about that. As far as positions go, I don't know what they offer there. They don't have a birthing tub. They do have a shower. I don't know if they have stools or anything. For pain relief, my main thing that I'm going to put when it comes to pain relief is I don't want to be anything. I don't really want pain mentioned. I don't want to be asked if I want pain medication. I don't want to be asked if I can rate my pain on a scale from 1 to 10 or whatever. Again, that has to do with the whole, I'm not in the hospital for a bad reason. I'm there for a happy reason, a natural process. I don't need to be treated like I'm going in for an injury. And I also, I don't want it to be that kind of pain association. Claudio, the cat is up at the fish tank, sorry. So no pain medication. I will ask for it if I feel the need for it, which I really hope doesn't happen. I do want to use acupressure. I want to be in the shower. I want to do breathing techniques, hot cold therapy, all of that fun stuff. The doula is going to help out. Matt's going to help out with that stuff. I don't feel like that needs to be there either. That can be voiced. My doula can help me voice that. Claudio. He's like sticking his foot in the fish tank. When it's time to push, I want to push instinctively. I don't want anyone counting. I don't want anyone telling me when to push. If I'm 10 centimeters and I don't feel the urge to push, I don't want to push. I want everyone to be quiet. I don't mind Matt. I don't mind the doula giving me words of encouragement, but I don't want anyone saying, now. My body is capable of doing this just like every woman's body forever and ever has been capable of doing this. You have contractions doing the pushing action. I don't really feel the need to have someone forcing me into something that my body is not comfortable doing. I can push in whatever position I feel. I already crossed that with my doctor. That was one of my main concerns, being in the hospital is position. So I made sure my doctor was okay with it when I first met him. I don't care about having a mirror to watch the baby come out. I don't know if I'll want to touch her head as she's crowning, but I'd like to have the option to. I want the room to be as quiet as possible. That's the self-directed pushing and everything. I'd prefer to tear naturally. I'd prefer to not tear. Again, self-directed pushing helps with that, but I don't want an episiotomy under any circumstances. And then if Matt wants to catch the baby, I want that to be an option for him, but I don't think he will. He's a little squeamish when it comes to that kind of stuff, so. We are a baby-friendly hospital, so they believe in skin-to-skin and breastfeeding right away. I just need that extended, kind of. So I will express that in my birth plan, that it's important that the baby be placed on my stomach, my chest, wherever the umbilical cord will allow. I do not want the umbilical cord cut or clamped until it's done pulsing. And then when it is done pulsing, I want Matt to cut it. He's not sure about it, but I think he'd regret it if he didn't. So there's that. The big thing, and I really need to talk to my doctor about this just so he has the heads up, is I don't want Pitocin in order to deliver the placenta. I want to do it spontaneously and naturally. If something comes up, I don't mind. You know, if they think I'm bleeding too much and getting at a risk of hemorrhaging, then I don't mind. But I don't want it to be an automatic procedure. Why would I go through a natural birth and then get there and be like, yeah, now you can pump me full of drugs. So that's important. I need to talk to my doctor about that. Just because my doula said that that's something they'll usually fight you on because it's a hospital liability. But it's not mandated. I just have to sign, like, a release or something. I want her on my chest. I don't want anything done to her. I don't want her wiped down or anything. I want her on my chest as long as possible. I want to establish breastfeeding before she's taken to be weighed or anything. And then we are not going to be doing eye drop, ointment, whatever. We are not going to be doing Hep B. We are going to do vitamin K only because I was taking an anticonvulsant my first 6 weeks I was pregnant until we found out I was pregnant. And that's one of the possible risk factors there. If that weren't happening, I probably would say no to the vitamin K shot. She needs to be in my presence at all times. If for any reason she needs to be taken away, Matt is to go with her. He is to be the one to hold her. They automatically let you room in. If for any reason, again, we don't want any bottles, we don't want any pacifiers. We want cloth diapers on her the whole time, which if they have to take her away for an extended period of time because of an emergency, I'll understand. It's not the nurse's responsibility. But as long as she's rooming in with us, she will be in a cloth diaper. We're exclusively breastfeeding, so that covers that. If we've only had one ultrasound this whole pregnancy, which is the way to do it, I think, because then you're not freaking out. But so if that happened to be wrong and we end up with a little boy instead, at least we have a name. He will be circumcised, but not in the hospital. We will wait the traditional 8 days to do it. And then as long as everything has gone well, we'd like to be discharged as soon as possible. So that's that 24 hours. That's what I'm packing for. With a little leeway in case 48 hours happens, but we definitely want to be considered for early discharge. And I think that's everything. I finished that pretty fast. I can't think of anything really that's important to me that I didn't cover. Yeah, no, I think that's it. Oh, guest after. We don't want anyone in the room. Definitely not post-delivery, not in the delivery room. When we're moved to the postpartum room, I think I'm still going to want a little time for me to get cleaned up and Matt have skin-to-skin time with the baby because I'm going to have her the whole time post-delivery. So when we're moved, and I want him to have some skin-to-skin time with her as well. That way I can clean up, and then we'll let the family in, and they're aware that they won't be allowed in for several hours. So my mom will be flying in. We'll let her know when I'm in early labor, and she'll be buying a plane ticket and getting on a plane. Matt's parents will be called when I start to push, and they can decide if they want to wait in the waiting room for however long it takes to push, and then that 2 hours in post-delivery and however long in the postpartum room. That's just a personal preference. And then they have to leave if I need to breastfeed. I'm super paranoid I'm worried about losing my privacy. That's been my big concern this whole time. So that just needs to be enforced. And Matt's very, very helpful when it comes to that. The doulas are helpful when it comes to that. We'll inform the hospital staff to not let anyone be like, oh no, but blah, blah, blah. Because it's not true. I don't want anyone there until I say. And if I'm not comfortable with the baby being held by anyone, they can come and they can see her and they can touch her, but I will hold her or Matt will hold her. That's just my anxiety, and I'm, like I've stated before, I'm already high risk for postpartum depression. So I think anything that helps with my anxiety level is going to be the best way to start off, right? I don't know. So any suggestions or any comments regarding all this stuff, or any questions about why I'm turning down some procedures? Good. I almost forgot this one. I do not want her bathed. I want her to not be wiped off. I don't want her bathed. I want the Vernix on her skin until we get home, at least. I might want to wait a couple days to bathe her, so nothing in the hospital. Because it's so good for their skin, and why would you ruin that? Anyways, so I think that's it. Alright, okay. That's my birth plan. I'm gonna try and write it down after I watch this video, and see if I covered all of my points. But I think I did. So, yay! Okay, thanks. Bye. Ooh, that was weird. Okay, bye.